Hi, Dr.Day here from Steinway Family Dental Center. We get a lot of questions about teeth crowding, and today we're going to answer some of the most common questions or the latest questions that we got from you and on this subject. The first question is, what causes crowded teeth and how does that affect your overall dental health? Well, first of all, crowding, what is it, right? Basically, if you put all your teeth in one line and the teeth size, the length of the teeth, the line that they occupy is bigger than the jawline, then of course there is less space for all the teeth to be fitted in that. Therefore we have crowding. It's kind of like everybody is trying to take a picture, and there is a lot of people and we're all trying to group together, and then somebody's or the photographer will say, squeeze closer, right? Why? Because we want to fit into the same picture frame. So the same thing with teeth. When we're trying to squeeze more teeth than the space allowed, that's when we have the crowding. Now, how does that affect the overall health? Well, of course, when there is less space and the space between the teeth are too tight and not enough clearance for you to keep it clean, it's much more difficult to clean. Like when you clean a straight surface, a flat surface, it's easier to clean it even when, let's say, you have tiles, right? And in the grout area, there's always something gets stuck. So when you're wiping it out, it's more difficult to clean that. Now, the tiles are usually flat, and the space between them is also flat. But if you think about it, the teeth are not flat. They like columns stuck together, like next to each other. The difference also is that now they're not just stuck, they're also crawling on each other because there's not enough space for them. So it's much more difficult to keep the area clean, no matter how hard you try. Now, what is the difference between mild, moderate, and severe crowding? Well, mild crowding is, let's say there is teeth are just tight, but they still more or less straight, right? So this is very mild, and some of them, because of how tight the space is, they're starting to turn, right? So that is a mild. In the moderate, the space is a lot more smaller, so the teeth are more cramped together, and therefore there is a food retention in there, and the gum is all inflamed, and so on. When you have severe crowding, that needs immediate attention because it just destroying the bone that's holding it and destroying the teeth. You can get decay from that, gum disease obviously, and the teeth will not last you long in that position. So it's better when they are straight up and they can breathe. The next question is, how is bottom teeth crowding different from the upper teeth crowding? Well, usually people notice the upper teeth more, so most people, if they have crowding on the upper jaw, they would notice it and they would have a problem with it and they would seek some kind of a treatment for it. Most people that have crowding on the bottom, like, yeah, those teeth are tight, but it doesn't bother me. They don't realize that causes a lot of stress on the bone and on those teeth, right? And therefore it leads for them to leave, for those teeth to leave them faster. So those teeth would be more damaged faster than the rest of the teeth, simply because of the crowding. The next question is, what are the options of fixing the crowded teeth? Now, it is a misconception that you absolutely have to pull some of the teeth for them to be fitted into your jaw. It's not always the case. It's in the very, very, very rare conditions when we would resort to that. For the most part, it's just the alignment of the teeth, and you should be fine with that. It's easy. The alignment does not take forever. It's not like what you remember 2, 3, 5 years from your childhood. It is much faster in nowadays. The next question is, can Invisalign fix crowded teeth, or traditional orthodontics, meaning braces, are better for that? The answer is they both can do the same thing. It does not matter what venue you use to uncrowd the crowded area. You can do braces, you can do Invisalign. In my opinion, braces is a barbaric treatment from last century. So if you like that, of course it's possible, but it does have its place. For example, if you have a teenager child who is non-compliant, braces are better in their case because they simply will not wear Invisalign. But if you're an adult or you're responsible enough, then Invisalign is a much faster choice. How does dental crowding impact the teeth alignment or the bite? It does affect it, because if you look at somebody who had crowding, most of the time the teeth on the bottom are not straight anymore, and the top of the teeth are also grounded out in a particular way. So those teeth are like cut on the angle instead of being straight. That's one of the things. Another thing that you can have is a lot of decay on the sides of the teeth, on the top. They ground it off, because when we do have misalignment, we tend to grind our teeth more at night. So there is a lot more damage done to the teeth when they're crowded. The next question is, what should patient expect before and after the treatment of crowded teeth? Well, before the crowded teeth, obviously you would spend a lot more time trying to keep everything clean, and there's still food traps in behind those teeth because they crowded and you can't really keep them clean, or it's more difficult to keep them clean. After, it would be easier to clean them. Most people, after they get the crowding fixed, they are smiling a lot more. So we just find out that people that have crowding, they're trying to smile with their lips closed, so they don't want to show their smile too much, and those people look much happier after the crowding and fixed. So they do show their smile and they look a lot happier. The next question is, how long does it take to correct severe teeth crowding? Well, depending on the severity, that's how long it would take. We have cases where the patient get the correction only within 2 months. Yes, it is a fast-paced moving teeth, and if you would like that, you can schedule an appointment with us and we will go over your smile to see if you're a candidate for it. But for the most part, I'm pretty confident that you can use that. The next question, are there specific challenges of treating the lower teeth crowding? Well, the only challenge is that the patient must be compliant. Other than that, there's no real challenges. If you're compliant, you're going to get the good results. The next question, what happens if the crowded teeth left untreated? Well, of course, if we're ignoring the problem that we have, that problem is not going to get smaller by itself. It's only going to get bigger. And there's a lot of teeth that patient had to lose because they have not corrected crowding. So I would recommend that you not ignore it, but attack it and fix it. I hope I've shed some light on this subject and it was helpful to you, but if you have any specific questions that we haven't answered yet, either send us your questions or you can come in and we can look at your particular case so we can answer your questions directly to you and see how we can help you to correct your smile. You can give us a call at 718-728-3314 or go on alldentalneeds.com and request an appointment, and we can discuss your particular case with you directly.